All right, thank you all. I'm Ariel Schatzel from OPWDD Talent Development and Training. Welcome to our 7th information session for MSCs transitioning to the role of care manager. We would like to just remind you before we get started that all the previous information sessions are located on our website, as well as the March 28th information session, Cultural Competency, Why It's Important for Care Managers. The April sessions will be added later this month, and the topics will be on there. All those sessions you'll be able to register for also on our website. Throughout the presentation, we'll be monitoring the questions that you submit, and we'll answer as many on today's topic as we can. Other questions we will address in future information sessions. And with that, I'm going to turn it over to today's presenters, Kate Marley and Kate Bishop, our Division of Person-Centered Supports.
Good afternoon, everybody. Thank you, Ariel. We're ready to get started on MSC Information Session number 7. And today our focus will be on some review and updates to the Educate to Enroll training that was presented in the last session on February 28th. We'll review some of those details and give you a little bit more information relative to those activities of enrollment. We're going to review in a little bit more detail the toolkit that will be available for MSCs. We've tried to compile some of the questions that have emerged from the field, and we are responding to those during this session so that we can follow up to the questions of greatest interest to you. And we're also going to go through a little bit more specific description of the 6 care coordination organizations that are actively moving forward within the system. So those are the content areas that we'll be focusing on today. And as Ariel said, we will have time. Our goal here today is really to have the opportunity for some open questions, a forum for you to ask your questions so that we are as responsive as can be to help you as we move forward with the activities that need to be taken on over the next several months. So just a bit more detail and an update on follow-up from the February 28th webinar. The training and enrollment and consent training will be coming for MSCs on the statewide learning management system, and that will be available in late March. All MSCs must take that training to be equipped to provide continuity of service coordination for individuals. We really want to make sure you understand how important this training is. We're going to go through a little bit more detail on what will be included in it with the toolkit, but we've really been working very, very diligently over the last couple weeks and working in cooperation with the CCOs to make sure that everyone was on the same page and everyone understands the steps that need to be taken to move through the process of education and enrollment and consent in a way that will be very clear to you. We're going to also have a video available that will demonstrate an enrollment discussion with a person receiving services so that you can see how it takes place, and hopefully that will be a good opportunity to get a sense of how those dialogues and conversations can be undertaken. The training, just as a reminder, the training that you're doing here in these info sessions, as well as any of the training that's posted on the SLMS system, will count towards your professional development hours. So that information will count towards those training hours that you need to maintain. So let's just review some of the activities that will be underway and some specific dates and milestones as we move forward. In late March, the SLMS enrollment training will be available for MSCs, and that will be an online training. You'll be able to go in and take as you're able, and to complete that and be able to verify within the SLMS system that that training has been completed. on 3/28, just before the enrollment activities begin, you'll receive the MSC, you'll be able to access the MSC Toolkit, and individuals through you will start to receive the personalized letters. They'll come to the MSC providers, and then as soon as those have been received and you've got your toolkit and you have your education and understanding, you'll be able to begin as of 4/1 to conduct education and distribute those informational materials and to assist individuals and their families and decision makers to make their choice related to CCOs over those next couple months. As of 4/15, the Choices Selection screen will be available in the Choices system, and MSCs will be able to record the selection made by the individual or their decision maker in the Choices screen. They'll be recording the decision of either the Health Home Care Management or the Basic HCBS Plan of Support. So those activities and that documentation will begin in 4/15 and continue through 6/30/18. And we know that we'll need to be monitoring after the 4/15 documentation begins to see who's enrolled, how many people are enrolled, how we're doing as far as enrollment of everyone receiving waiver services and currently getting MSC and PCSS. And to that end, OPWDD will begin sending monitoring reports each week to CCOs and MSC providers to assist in determining who's been verified as enrolled in a service, in a CCO, as starting on 5/1. And that will allow for the month of May, the full month of May, the full month of June, to really be able to monitor and determine who's enrolled and who needs to be enrolled to assist you all with being able to make sure that that process has been completed for everybody. We expect that all of these activities will be taking place in partnership among all of you as MSCs, MSC providers, with CCOs who will be assisting with those activities, and with OPWGD, regional office and central office. All of us will be working together to make sure information is clear, to answer questions that emerge, and to make this process as smooth and reasonable as we can make it. So let's just review the information that will be available within the MSC Toolkit. You'll be receiving the CCO informational brochure. That's a tool to be able to share with the individuals and families and other decision makers on the CCO to identify the options available to the individual. We will have scripts available to you within that toolkit, and the scripts will focus on activities related to education and consent, so that you are able to feel confident as you engage in the dialogue with individuals and help them and their decision makers make the decision relative to transition into the CCO. You will be receiving a sample individualized information letter that will be similar to the ones that are given to you in the individualized packets, that show you what information will be shared with individuals so that they can be assisted in making the decision about choosing their CCO. You will receive documents to support the individual's selection of care management and be able to document that. And we are also including within the MSC Toolkit some documents for frequently asked questions. One is geared to MSC specifically, and the other is geared towards individuals and family members to help arm you with answers to questions that we hear most frequently so that you feel well prepared for the dialogue and the discussion for enrollment with each of the people that you are currently serving. So how will you access the toolkit? That was a question that came up repeatedly during the course of the last 228 session. The toolkit will be available on the OPWDD website. It will also be provided to all MSC provider agencies so that you can reach out to your provider agency and receive the MSC Toolkit materials that you'll need for the dialogues and the discussions that you'll be having. Also, the SLMS Training has a resource section, and the toolkit will be available within that resource section of the enrollment training once that SLMS system is up and available for your use and education, which is again, that SLMS training, just as a refresher, is a more in-depth version of some of the 228 presentations and some of the materials that we'll be covering today that will give you some greater detail and information around the enrollment process. So this is a picture of the informational brochure, just to give you a sense of exactly what will be included in that toolkit and informational packet. The information is geared to be very easily understood and shared in a way that we think is going to be a helpful way for individuals and families to make the decisions that they need to make. It will include a discussion of the benefits of the health home care management, and we just need to reiterate the investment of the service system that we've made into the health home care management model is really to enhance and improve that service for individuals who are receiving support and to assist in ensuring that the most robust and comprehensive care management option is available to individuals receiving supports and services. The brochure will focus on what care coordination organizations are, what is a care manager, a description of what a care manager is, why OPWDD is transitioning from MSC to health home care management is discussed within the informational brochure, what individuals must do to continue receiving care management services. So what is the ongoing service, the 6 health home services, what will be occurring for individuals receiving those services will be discussed within the brochure, and a description of what a life plan is. The ISP, as you know, will transition to a life plan, and there'll be a bit more information about what a life plan includes and what a life plan entails. Also in the toolkit, as I mentioned, are going to be scripts for MSCs to educate individuals and their decision makers. You will be responsible for communicating the systems change that will take place in July 2018 for all people you currently support. And I think, you know, we spoke to this in the 228 presentation. It's important to recognize if you're an MSC who's shifting into a care management role, or you're an MSC who is not shifting into a care management role. The work over the next several months leading us to July of 2018 is really about the activities to enroll in a new care management option that must be completed for all individuals currently getting MSC and PCSS. So whether you are transitioning into the new role of care management or not, the expectation over the next month in your current MSC role is to assist people in making this decision and this transition in the most smooth and reasoned way possible to help reduce anxiety as well as to reduce any risk of loss of supports and services for someone who's currently receiving those. Additionally, the scripts will help you to know what to say to individuals and families as they make choices about care management options. And of course, everyone has their own flow and their own way. We don't expect that you're reading a script verbatim. You know people well. You've learned and understood this system. But the script does help to provide a framework for how to move through the steps of the discussion in a way that's logical and follows along with the other materials in your toolkit package. So again, the script isn't meant to give you exact language, but to give you a framework to use to assist you in those discussions. So the individualized information letter will also be a very helpful resource for you to use with individuals receiving supports and their families in order to help them make a decision about the enrollment and to complete the enrollment process. So the individualized information letter outlines the transition to care coordination organization, so it really just alerts individuals and families to the fact that this transition is taking place and the timeline, meaning by July 1st of 2018, that transition must be completed. It alerts them to the CCOs available in their region. So each of the regions, and we're going to give you a bit more detail on that later in the PowerPoint, but each of the regions has at least 2 CCOs operating, and it'll identify what CCOs are available within the regions. You'll need to do a bit of review and determination or clarification around the county where the person resides to make sure that the information around the available CCO is very clear within that region. Make sure that it's accurate, the county that the person lives in, to be sure that that's completed. And that's really best to do ahead of the discussion with the individual and family, so that you're making sure that you've got the right information when you have that dialogue, and that you've clarified anything that may need to be clarified before you have the conversation. The CCO and his or her current Medicaid service coordinator, provider coordinator will be joining. So it's important for you to be able to share. Many families are very interested in maintaining the relationships that you've all built with them over the years. And, you know, I was just out in Long Island earlier this week, and we heard from families, you know, I have a great relationship with my Medicaid service coordinator. Will I be able to maintain that relationship? And where you are able to clarify that you will continue to be able to support that person, or that the agency will be participating in a particular CCO, you should feel free to share that information. It will help alleviate concerns from individuals and their families or decision makers, because people really want to have continuity in many instances, and the relationship that's been formed is such an important relationship to people. You want to offer the opportunity for that to continue. And then the individual letter also identifies the care management options that are available to the person receiving supports and services. So we want to go through, these are some of the questions that have come up regularly during the course of some of our other sessions, and we wanted to make sure that we had an opportunity to share the answers with you. And again, we are leaving some time for open forum discussion points and questions that you may have as we proceed with this session today. So I want to go through a little bit more about what the basic HCBS plan of support is, and some language and some focus that you can use as you share, because people really want to know what is basic plan of support. So the basic care management option, and we've spent a lot of time, the reason we have this slide in this PowerPoint today is because many other sessions, including several sessions geared specifically on the health home option, gave you a great amount of detail about what the health home care management service is, because of course that's what we've invested in, that's what we feel is the most comprehensive and robust service, and that's the service that we feel is best for people to engage in to really move the system forward in the way that we've been talking about over the last several years, and to enhance the services and the supports available to individuals receiving services in their families. So we're focusing on the basic HCBS plan support today because that has not been as fully defined in other prior presentations. The basic care management option is quite a limited option and is most similar to what people find or are familiar with as the Plan of Care Supports, or PCSS. So it's really about just maintaining a plan, maintaining a support plan for someone. It offers less than the current Medicaid Service Coordination Service. And one of the things to focus on, we've gotten a lot of questions around people who are self-directing and whether or not the basic plan of support is the better option for them. And I think there's some sense, a couple different things we've heard through feedback around this. One is that, you know, if you're self-directing, you don't need a great deal of service, and we're going to go through some additional points with regard to specifically self-direction because the questions have come up repeatedly, so we'll have more later in the PowerPoint. But one of the elements, one of the things that keeps people sometimes from being able to self-direct is that they don't have a real strong circle of support available in their life. And in some instances, families aren't able to maintain some of the ongoing activities associated with a person who's choosing to self-direct. So the health home care management offers more support and more options available to people. The HCBS plan support option will require only a minimum of 2 annual contacts and a maximum of 4 annual contacts. So for people who have ongoing and reoccurring meetings related to implementing their self-directed plan options and making frequent changes to their self-directing plan, that option may not fit well with that service. So we just wanted to call that out specifically. One other area related to the basic HCBS is there's some fear and concern around movement into a managed care system. And there's, I think in some thinking or some circles, there's a sense that, well, if I choose the basic plan of support, then I don't need to move into a managed care option down the road. And I just want to say here, and may repeat it again later in the PowerPoint, that the choice between these 2 options within a CCO does not have an impact on a future choice related to managed care. They're 2 very separate and different things, and choosing basic now does not have an impact on the options that will be available to you in a voluntary model for managed care in the future, or the requirement for mandatory managed care as we get to that point, as we transition as a system into a managed care option. So that is, I just need to reinforce that point and make sure that you understand that health home care management is not managed care, and both of these 2 care management options are occurring within a fee-for-service environment where services are waiver services delivered by providers of services just as they are today. Additionally, on the basic option, there are no limits of caseloads within that option. And the holistic and wellness focus of the health home care management core services are not a part of the basic HCBS plan support option. So those are important things for you to understand, to be able to communicate to individuals and families and other decision makers around what actually is in the basic HCBS plan support. So here's another chart, and this chart really is a duplicative chart of what you will find in the informational brochure that you'll be using with individuals and families, and you'll have more detail about this as we move into the more in-depth model, or the more in-depth training session that's going to be offered on SLMS that you'll be able to participate in and need to participate in. But just to review quickly with you today, the health home care management develops a care plan and reviews that plan biannually, is responsible for monitoring health and safety, and in addition to those 2 things, coordinates access to behavioral health services, coordinates access to medical and dental services, identifies and facilitates connections to community-based resources, uses technology to link those services, and what we've talked about in many of the other sessions is how important that technology and linkage is to the the 3 bullets ahead of time, is that the information sharing and the communication is critical to ensuring that people are getting the services that they need, and that the providers of service are talking to each other and understand what the person needs and wants from the services available in their communities. It connects care providers and works collaboratively with individuals and families to navigate systems. And in contrast, the basic plan of support, it just develops that care plan review biannually and monitors health and safety. As with any service that we have in the system, there must be a review of the person's health and safety and response to any areas of risk and concern for that person. So does an individual need to choose health home care management or basic HCBS plan support to receive HCBS waiver services? This question came up repeatedly in the last sessions, and yes, in order to receive waiver services, an individual must receive either health home care management or basic HCBS plan of support services, because you need someone to draft your plan and develop the supports with you in coordination with your team in a person-centered way to deliver those supports. So yes, you must have one or the other of the care management services. How will the implementation of care coordination organizations affect self-direction? The current self-direction model will not be impacted by the implementation of CCOs. The CCOs and care managers are required to help people self-direct their services if they choose, so that doesn't change. Just like in today's world, if people are supported to pursue self-direction, they will continue to be supported by care managers in their options for self-direction. The broker and fiscal intermediary services remain part of the waiver service system and will remain in place there. That does not change. The CCO will be serving as the care manager, as does the MSC in today's world. Personal resource accounts, or PRAs, will continue to be set by the state, and that will occur in the CCO environment as well as we transition into a managed care environment. I've touched on some of these areas around the benefit of health home care management for people who choose to self-direct their services, and again, we see that the option for people who choose to self-direct, the benefit will be significant from the health home care management service. It will add a layer of support. Remember, these are people who are often not connected to providers as a safety net within their system, so the benefits of a health home care manager will be significant as they coordinate their current self-direction plan and manage cross-systems or future planning needs if their service needs change over time. The health home care manager role should reduce the family member concerns. So many families are concerned, what will happen if I can't play as active a role in my person's self-directing plan? Having a more robust service will assist the individual who's self-directing to have a stronger safety net. Feedback has told us that self-direction works best with a strong coordinator involved, and health home care management strengthens the circle of support for people who are choosing self-directed service options. So if a family member does this, meaning does all of the supports and services for many people, why is there a need for a care manager? And again, many families worry about the future, and a stronger care management service will help people manage their service needs over time, as changes may occur both within their own service needs as well as the circle of support and the people who are supporting them. What if an individual has a healthcare provider and doesn't have behavioral health needs? We've gotten a lot of questions in this area, thinking that, well, if I don't have complex needs and I don't have a lot of cross-system support, will I really benefit from a health home care manager? And the answer is yes. We've built a system of support. The health home service is an opportunity to have a safety net available in the event that there may be needs that emerge over time for people. It doesn't require that there be a higher level of service than the person needs, but it does require that there be a response as needs emerge. And remember, the core services are not only focused on behavioral health and healthcare needs, but also focus on social support, education to the individual and their family members and support circle, and general wellness and planning that will benefit everyone, not just those people with the most complex needs. An individual's healthcare provider becomes a member of the team so that the health needs of a person are considered and planned for in the life planning process. And that's a critical shift in our system, and it integrates health with general supports and service needs in a way that it's not as though health needs aren't looked at today, but they're not integrated as fully across the continuum of supports for people. And the new model of health home care management will better integrate all of those elements that are most important in a person's life, including their health and wellness. So now we're just going to quickly go through the 6 care coordination organizations, and I'll read them out. Advanced Care Alliance, Care Design New York, Life Plan, Person-Centered Services, Prime Care Coordination, and Tri-County Care. And we have a great map here, and you will be able to use this map as you look at the counties of residence for the individuals that you're reviewing on your caseload to make sure that there's good information and accurate information about the available CCO within the region where they are residing. But this map really shows the regions and where CCOs are covering. And some CCOs are covering, they must cover one entire region, but some of them cover more than one entire region, and some cover an entire region and a subset of other regions. So you'll be able to see from this color-coded chart exactly what's covered. And as I mentioned earlier, each region has at least 2 CCOs in place. Many you can see have 3 or even 4, or Region 3 has 5 options to choose from within the CCO options available to individuals. And again, those are by county and region of the state. So with that, I'll end. And thank you for your time today. We did go through the full half an hour time, I think, but we do have some time for questions that have come up during the course of the presentation.
All right, I've compiled quite a few.
Okay.
So let's start with, I'm going to go to the beginning. Will there be an announcement when the SLMS training is available?
Yes, the training will be announced via an e-advisory and will be announced by OPWDD as soon as it's available online for you to participate in.
Will there be webinars or forums available for families and advocates?
Yes, OPWDD just announced, and you should be seeing this today. It just came out this morning. Just announced that public forums are being held in the upcoming weeks for individuals and families to learn more about new care coordination organizations. Each forum will be hosted by OPWDD's Regional Office Director and will have OPWDD and CCO representatives on hand to answer any family and individual questions that come up during those forums.
Can MSCs access the scripts today as some of the service coordinators are beginning to meet and talk with families?
I think we'll get that information out as quickly as we can, but it will need to be done in one final packet. OPWD is working to finalize the documents, and will make them available in conjunction with the enrollment training so that we can ensure that MSCs have all of the information and training they need to accurately discuss and document this transition.
Okay. Will an individual be able to opt out of care management services if they only have MSC today?
If a person, so the requirement that Kate Bishop discussed earlier was that for people who want OPWD comprehensive home and community-based services, you must have a care plan, a life plan, and therefore you need one of the 2 services. So if a person does not want OPWDD services, they do not need to make that choice. But to be clear, if you want to access OPWDD services, it's very important that, that you do make the choice between either the health home care management or the basic HCBS plan support. And I would say that's not just a decision for today, but you have to think about maintaining eligibility and things like that. So it would be a decision that I would encourage very careful consideration of.
Right. And just to add one more thing, just to be crystal clear, the MSC service will go away and sunset as of 7/1/18. So if you don't choose either basic or health home care management, you will not have a coordination service.
Should MSCs document in their monthly notes the discussion they are having with families about their CCO and care management choice?
Yes, MSCs can document that activity in their monthly notes. Good question, thank you.
Yeah. Will individuals and families have the option to change plans at a later point if they decide they want to?
Yes, they will be able to change their choice of either CCOs, or they can change from either basic plan support to health home care management or vice versa as they choose.
And will this process be relatively easy? How will individuals transition between the 2 services if they want to change?
Yes, this will be a simple process. They'll just need to speak with their care manager at any time and identify that they want to make that change, and the decision will be effective the first of the following month.
Okay. What happens if an individual lives in an area that is not covered under the CCO that their current MSC is transitioning to?
People are going to have to make a choice of the care management service within their region. By and large, we think that there's going to be very few people that are going to experience that, but that will have to adhere to the operational areas of the CCOs.
Can children receiving early intervention services choose either basic plan support or health home care management service?
We will have guidance on that shortly.
Thank you.
There will be, I just want to stress though, for kids who are in EI that currently get, I believe the way we manage that today is that children who are in EI who may be transitioning to OPWDD services will typically be provided with PCSS. So we're looking to maintain continuity for those kids, but we will have information out shortly.
And we received a couple questions about this, so could you just clarify one more time? Will health home care coordination and basic HCBS care management be a standalone waiver services under 1115, or will an individual have to maintain additional waiver services to receive either care management service?
Okay, let me break that down a little. So anyone today who receives MSC or plan of care support services will need to make the choice between either the health home care management or the basic HCBS plan support. So you must do that. You do not necessarily have to be actively receiving waiver services, but you must be eligible for OPWDD services and have an ICF level of care. So anyone who gets PCSS or MSC is going to meet those qualifications.
Thank you, Kate. Okay, another question we received. The basic HCBS care management service slides refer to 2 annual visits with 4 maximum annual visits. Is this meant to reflect a year or in a lifetime?
That would be a yearly level of contact. So that those are meant for yearly measurement.
Thank you. I'm just looking to see if any came in while I was reading them. Another question came in about if an individual receives MSC only right now and they are not enrolled in the waiver, how will that proceed?
Okay, so for folks who receive MSC only today, you are eligible for either basic plan support services or the health home care management, and you must make that choice. So folks today who get MSC only meet the eligibility criteria for the 2 services beginning 7/1, and you will need to make that choice just like everybody else who's enrolled in MSC.
Thank you. I'm just looking to see. Sorry, I'm just reading these. I think that pretty much captures them all. Am I missing it? Okay. I think that captures them all.
Well, great. Thank you for your questions. I think this hopefully helped you, reiterate some of the material that we've been talking about, but also, be responsive to the questions that you've had on your mind since we've been doing these sessions and trainings. So we'll look forward to a couple weeks from now on the cultural competency discussion, and we'll look for the advisory announcing when the training will be available within the SLMS system. So thanks again. Have a great afternoon, everyone. Take care.